In 2008, Atul Gawande, a renowned surgeon and public health researcher, piloted a powerful innovation to improve surgical care in 8 hospitals around the world. Only 3 months after implementation, the effect of this innovation on health outcomes in all 8 hospitals was astonishing. Results showed that the use of this cutting-edge tool cut the infection rate in half. It reduced the rate of major complications by 36%, and the death rate fell by 47%. What was this groundbreaking innovation? A checklist. Every day brings new developments in research, technology, and tools that have the potential to improve global health. However, these developments do not automatically change health outcomes. Health professionals need to know about these developments in order to put them into practice. Why did a simple checklist halve the infection rate? It offered staff the exact knowledge they needed in the moment they needed it. In other words, it gave them the capacity to act effectively in a high-pressure, fast-paced environment. This is a powerful example of what knowledge management can achieve. There are 2 types of knowledge. Imagine an iceberg. Explicit knowledge is tangible, visible, and easily expressed. It can be shared through presentations or written documents. However, explicit knowledge is just the tip of the iceberg. Most knowledge is tacit knowledge, intangible, invisible, and based on first-person experience. Think about riding a bike. Chances are you didn't learn to ride a bike by reading instructions. Instead, you likely watched a friend ride a bike, got tips from a parent, and finally tried it yourself. Now riding a bike is second nature to you, but it's hard to articulate this knowledge. Tacit knowledge is the part of the iceberg that is submerged underwater. It includes skills, insights, and intuition, and is often shared through discussion, stories, and observation. Knowledge gives us the ability to translate evidence into action. There are 3 primary components of knowledge management: people, processes, and platforms. One approach is online communities of practice, or the use of information and communication technologies to connect people with common goals and interests. In communities of practice, people engage in knowledge management by exchanging ideas, telling their stories, and sharing best practices. To facilitate this exchange, they use processes, such as webinars, to ensure essential knowledge is systematically captured and shared in a timely manner. Electronic information repositories, such as online toolkits, evidence databases, and photo-sharing websites are all examples of knowledge management platforms. Other platforms include mobile phone applications, intranets, and data visualization software. Besides communities of practice, other knowledge management approaches include after-action reviews, storytelling, and share fairs, or events where participants learn from each other's implementation successes and challenges. By facilitating the exchange of life-saving evidence, expertise, and experience among health professionals, knowledge management plays an essential role in strengthening health systems and improving health outcomes around the world. We all do knowledge management every day, often without noticing it. Sharing a report with a colleague, posting a question on an online forum, or even meeting with another organization to give advice, this is knowledge management. Why should you use knowledge management in your health program? The answer is simple. It can lead to a more capable workforce, which in turn strengthens health systems, enhances quality of care, and ultimately improves health outcomes. Knowledge management can be as simple as a checklist in the hands of a surgeon whose patient walks out of the hospital sooner and healthier. Knowledge is essential to improve public health. Knowledge management ensures that it is translated into action, not only improving health outcomes, but saving lives.